Thanks, Sarah. Good morning, everybody. Thanks for joining us this morning. I'd like to let you know that this is actually the largest registration that we've had on the WIPNET webinars to date. And we thought perhaps that might be because there was some confusion in the thought of the title of this, and that some of you actually thought that we were doing a webinar on getting stoned and plastered. That's not actually correct. So we expect some of you to drop off at this point. We're actually going to talk about stone and plaster in the dental industry. And we would think that this is a topic that most of you would already know a lot about, and unfortunately, that's not the case. We found that there's been a lot of misunderstanding that's been passed down over even generations of time. Many things have been mistaught, and in general, stone and plaster have been treated like or even referred to as dirt. I've heard other technicians say, well, dirt is dirt, and that's not really accurate. There are a lot of things that do go on and are part of your restorative process. And so we're going to talk about that, go through a few of those kinds of things this morning. Let me move over here and away we'll go. All right, so the first question we have to ask is, why are there so many different choices in stone? I think if you look out in the market, you're going to see numerous manufacturers of stone products, and there are certainly choices ranging from going down to the hardware store and picking up plaster and right on through to some of the finest quality plasters in the world, like those that you find at WIPNET. And the question is, why? Why are there so many? Well, I think part of the reason that you have to talk about when you look at the WIPNET Corporation is that just 3 years ago we celebrated 90 years in this industry. And after you've been producing these products for 90 years, you're going to have a good, stable, full, if I can make a nod to the Kentucky Derby that's coming up, you'll have a good, stable, full of products, some that have been around for quite a number of years, some that are the newer versions of things that we need based on dental laboratory technology that we're doing today. As long as we have demand for a product, we'll continue to manufacture that product, and so you see a lot of different dental stones and plasters. Now, we need to do just a little bit of science here. Some of you perhaps have attended one of my gypsum science courses that some of the meetings are about. We've not done a gypsum science course directly as a webinar at this point in time. But let's do just a little bit of science so that you understand it. Gypsum comes out of the ground as calcium sulfate dihydrate. And this is that first indication that you see at the top, the chemical indication that you see, the CaSO4 2H2O. This is its normal state. It does contain water. Those of you who are familiar with a little bit of chemistry can see those two molecules of water attached to this gypsum molecule. Because of that, we go through a refining process. We don't do that here at WIPNET. Most of the companies that you purchase these materials from don't do it. We rely on companies like US Gypsum to do this raw product refining for us. They'll take that product out of the ground, they mash it up in large bins and heat it. And that heat process goes up somewhere between 110 and 130 degrees centigrade and drives the water off. Now, not all of it, but you'll see it takes off 1.5 waters, and it converts that molecule into what's called a hemihydrate, CaSO4 1/2 H2O. So it's lost 1.5 waters. Now, if we further refine it by increasing the temperature and continuing to crush this material, we can change it completely from a hemihydrate into an anhydrate, which is the anhydrous calcium sulfate molecule, which you'll notice down here at the bottom is calcium sulfate with no water attached at all. that's when it gets up over 200 degrees centigrade. With that in mind, your responsibility as a dental technician is to take this product that has been changed from its natural state and return it to as close a natural state as we can get it by adding water to it. What it needs is 1.5 water molecules. It doesn't need more than that to do its job, but it does need that 1.5. Now, the interesting thing about gypsum is that because the state that we use the gypsum in is not its natural state, it is going to capture that water from wherever it can. And that includes the air. And to pull moisture right out of the air while it's sitting in an exposed bin or hanging around by your sink, or for those of you on the coast, as the fog moves in and the fog moves out, and your water content in the air goes up and down, or perhaps those of you who are down along the Gulf Coast know, this material has a tendency to suck water in, and then it changes some of its properties that you're used to working with. And so we're going to talk a little bit about that as we go. Now, in general, gypsums are separated into 4 groups. That is plasters, model stones, specialty stones, and dye stones. And it also is broken by the ADA and ISO requirements into 5 different types of stone. And we'll talk a little bit about those as we go along also. Now, the 4 groups that Whitmix uses are the dental plasters. These are ISO type 1 and 2 stones. This is the beta version of the hemihydrate. These dental plasters you're very familiar with. They require large water to powder ratios, as much as 60 milliliters of water for every 100 grams. There's a lot going on there. We don't use them for a lot around the laboratory, other than for general purpose kinds of things, like perhaps we use them for mounting. We use it just to hold parts in place. We just use it as an all-around go-to kind of a product. Now, the second group are the dental stones, or what we'll call model stone. Some of you are used to calling it yellow stone, and I will reiterate what I've said in other courses, and that is that yellow stone is 2 things. First of all, it is a color of stone, yellow, and it is a national park. It is not a type of dental stone. So what you're talking about there are those ISO type 3 stones. They are the alpha version of the hemihydrate, and they have different physical properties once they're manufactured into a type 3 stone. The next group are the dental dye stones. These are the ISO type 4 and 5 stones. This is also an alpha hemihydrate, but it is in a denser form, meaning that the crystal size of the particle size is smaller, and therefore they can be packed more densely. And we use them for generally creating master models. The last one are the specialty stones, and we'll talk a little further about some of those. Most of these are ISO type 3 and type 4 stones. If we take a look at some of the other specs that are going on, we'll find that in the ISO specification 6873, we can talk about how they're broken into these 5 types of stone. You see type 1, remember we said that those type 1s and type 2s were generally plasters. These will have a setting expansion anywhere from 0 to 0.15 in the case of the type 1, or from 0 to 0.3 in the case of a type 2. And they have a compressive strength minimum. This is a minimum value that's here in the right-hand column. Type 1 somewhere between 580 to 1160, and type 2s need to be 1300 psi minimum. Now, as we get into a type 3 stone, you can see once again that the expansion can be anywhere from 0 to 0.20. This is a percentage, and we'll talk about that in just a second. And the compressive strength must be at a minimum of 2,900 pounds per square inch. That's its minimum value. Now, as we get into type 4s and 5s, these are our die stones historically. Type 4 stone can be anywhere from 0 to 0.15% expansion with a minimum compressive of 5,100 psi. And then you'll notice in type 5 stone that that expansion is a minimum of 0.16 to 0.3, still has a minimum compressive strength of 5,100 psi. The interesting thing to note about dental technicians is that for some reason out there at some point in time, we started believing that compressive strength meant hardness, and it doesn't necessarily mean that. What it does mean for sure, if you change from a type 4 to a type 5 die stone, is that you will get increased expansions. And you need to factor that into your thinking and into your planning for what's going to happen in your dental laboratory. Now, let's talk about dental stone expansion information. First of all, when dental stone expansion is reported, this is a report that's done at a 2-hour test. So 2 hours from the point of mixing the correct water-powder ratio. 2 hours later, the test is completed, and that is the expansion for that particular dental stone that is reported in the literature. You also need to know, however, that dental stone continues to expand after that 2-hour mark as the crystals grow, and it can expand for up to 78 hours. Now, what's important about that is that for years and years and years, dental technicians and even dentists have been taught or assumed that the reported figure was the maximum expansion of that material, and that is not correct. Each material has its own little expansion that it continues to do as the crystals, which is what gypsum is, continue to grow. The rate that they expand and the total expansion is going to be different depending upon each and every die stone and each and every die stone's manufacturer. So you can't just say a type 3 stone will expand X% more. It doesn't do that. It's going to depend upon the other chemistry that's involved with it that create the other physical properties in that material. Now, expansion test equipment is different depending upon where you are, and so I wanted to show you what we use here at Whitmix. We use what's called a SAM gauge. This particular gauge is 100 millimeters long from the inside wall to the inside wall, and in that gauge we place 100 grams of mixed stone. This is a good value for us because it gives us not only an overall expansion number, but because it's 100 millimeters long, if that increases to, say, 0.08, then we know that it is also moved in a linear fashion, 0.08 millimeters. Now, that's for 100 grams. Remember, this is a percentage. This number is a percentage of volume. So if you're using 200 grams of material, you're going to get a larger expansion linearly. It will still be point whatever percent, but the actual movement will become larger. And the larger the volume of material you use, the larger the actual movement will be as a percentage. So you need to remember that as you look at the percentages that are being reported. And then as you think about how large you're making your individual model. Now, let's talk about strength for just a minute. There are two types that we think about. First of all is compressive strength. This is the value that is reported for all of these stones. This is a value that was needed a long time ago. Began basically when we weren't doing a lot of crown and bridge, but we were doing a lot of denture work, and we were placing materials inside of a flask, which was surrounded by stone, and then compressed in some kind of a pressure device to allow us to process denture material. I would, however, say that most of you who are crown and bridge dental technicians never put your models on the floor and then step on them. That's compression. The only other place that you would probably see compression is if you happen to have your models on a large articulator and drop the upper member of the articulator and have the models, the upper and lower models, smash into each other. That's a good example of compression also. The place where we get a little confused at times is when that strength issue becomes one of tensile strength or flexural strength, and that example is shown on the right-hand side of the screen where the pressure would be. This is the classic of that little lower anterior preparation that you so diligently poured into an impression, and every time you pull the model work from the impression, that little anterior prep snaps off in your stone. You get upset with a stone manufacturer, call them, and perhaps make the mistake of saying, I need to switch to a type 5 stone so that it'll be harder. It's not necessarily going to be harder, but you will remember it will be larger expansion, changing the size of everything in your end product. So you can't make that assumption. You need to know that gypsum does not have good flexural strength. Much like glass, for example, you can, you'll notice as you drive around, those companies that deal in glass always transport their glass standing on its edge. They don't put it down flat. Why is that? Well, standing on the edge generally gives it a little more compressive strength. If they do lay it down flat, it needs to be laid down on a surface that's absolutely flat with nothing underneath it. If you take a piece of glass and lay it on the floor, let's say a vacuumed, nice vacuumed carpet floor that's absolutely flat, you can walk all over it without any problem. Take a little BB and put it underneath that glass and then walk on it, it's going to break. Doesn't have good flexural strength. Has good compressive, lousy flexural. And we can do that. Generally speaking, we can associate that with the term brittleness. And so the higher up the tensile gauge we go into harder and harder and harder materials, generally speaking, the less and less flexible they are, and the more they will fracture. So you need to be careful as you work into higher and higher and higher compressives also. You may find that you get a little more and more and more brittle with your stones. Okay, now, hang on. There we go. This is the equipment that we use for compression testing here at Whitmix. This is called a Tinius machine. And basically the dial factor is on the right side of the machine. You can see that there. On the left side of the machine, which at the base, which looks kind of like a green flexible bowl flipped upside down. On top of that, we would place a cylinder of the material we're going to test. Generally, it's about the size of a 60-gram investment ring. We would put that material in there, and then the machine would begin to crush that material. At the point at which enough pressure is applied to the material and it fractures, that fracture reading would be read on the scale at the right, and that's the compressive number that's reported. Now we do several tests to get a rounded figure, because you'll note that, you know, for example, if we have a little bubble in that piece of material, it's going to be weak at that spot, it's going to fracture a little bit quicker. So we do several, usually 6 to 8 of those are tested in any given batch to make sure that it conforms to what our standard is. So we do really rigorous compressive testing along with the other testing that goes on here at Whitmix, so that the reported figures that you see on our charts are actual figures that we consistently test to. Now there are other behaviors or physical properties, and they're divided into the following. There's the water-powder ratio. That water-powder ratio generally will be different for each stone and each type, ISO type of stone. There will be larger water requirements for an ISO type 1 and 2 than there will be for an ISO type 4 or 5. And that is because of the size of the particles and the amount of water it takes to bind them back together again. Now you're also going to have different mixed times and working times. The mixed time is the amount of time that you spend either by hand or with a power mixer mixing that material. Working time is the amount of time that you have to actually work with the product. And then there's setting time. Setting time is not when you can remove it. That's a different factor altogether. Set time is purely when we have what is called loss of gloss. You've all experienced that. Once you mix a stone product up and pour it, it'll still be wet and shiny on the top. At some point, that shininess goes away. That's your loss of gloss. That's the set time. However, it is not the time that you can remove it from your impression. Most stones, and that includes dye stones and dental plasters, should be removed somewhere early at a half an hour and then past that point in time. But generally, it should be a half an hour minimum, unless it is a stone which has been designed specifically to set at a faster rate of time. All right, now, what about making the choice? How do we make that choice between stones? Let's talk about it for just a minute. First of all, you need to decide what your area of usage is. And you may, if you're a removable laboratory, an ortho lab, a fixed lab, if you're doing implant work, you may want to change the stone that you use to have a stone specific for those products. And we can see that. Let's go through some of these. First of all, if you're a removable lab or you're using doing removable products, generally you're going to be using ISO type 3 stones. These are the ones we referred to earlier as Yellowstone Park, or the color yellow, or buff is the other color that they usually are. Generally, you'll use that stone for both master and working models. It seems to be the one that's around. It is in the mid to lower compressive strength area. You might use a specialty stone like a rapid flask that's been designed specifically for a technique. Some will use plasters, which is a type 2. And then you may find yourself using a mounting stone or a mounting plaster when you are actually articulating your model work. Now, some removable laboratories have concocted, for lack of a better term, their own flasking materials by combining type 3 stones and plasters. And generally that recipe has come down from technician to technician to technician. And the reason it works is because it's been modified and changed over time until we have a success. Generally speaking, though, you need to know that plasters are designed to work a certain way, and model stones or type 3 stones are designed to work a different way. Different set times, different set rates, different water powder ratios. And so simply combining them puts two different products in a fight with each other, and you may wind up with something that you like and that works for you, but you also may wind up with something that's failing for you in other areas. So if you're going to make those kinds of decisions, you need to be sure that you are checking to see if you have other problems show up with your completed product. Now, if you're an orthodontic laboratory, you're probably using orthodontic stone, which is an ISO type 3, perhaps orthodontic plaster, which is a type 2, and maybe a mounting stone or a mounting plaster. Most of the orthodontic stones that are out there, seems that the critical factor is how white is it. Those of you who are ortho folks, you know that you're just a little more odd than the others. I mean, anyone who spends all that much time grinding angles on a grinding machine, you know that there's a little difference between you and a regular dental technician. So Ortho stones are those that would be used if you're going to have a maybe a model that's going to be around for diagnostic use, or that's going to be around a lot longer than your standard orthodontic plaster. Also, the expansions are different for orthodontic plaster and orthodontic stone. Ortho stone, generally you're down around 0.09%. Orthodontic plaster is quite a bit larger, up over 0.18 generally for those that are on the market. You may choose, for example, to use an orthodontic plaster if you're producing some kind of a methylmethacrylate restoration, assuming that if you produce it on a larger model size, with the shrinkage that's involved in methylmethacrylate, when you go back to a master model, which is poured out of an orthodontic stone, you might get a better fit. That's just one consideration. And then, once again, mounting stones and mounting plasters, which can be used for mounting articles. Crown and bridge froze. You guys are usually the ones that use all kinds of different things. So, you may be using a ISO type 5, which you will remember has a larger than, or it begins its expansion at 0.16, so it's the large expanding end. You may be using an ISO type 4, which is the smaller expanding side of die stones. Model stones for opposings, perhaps. You may use a mounting stone or a mounting plaster, certainly plasters at times, and maybe even some of the specialty stones that are out there on the market for various types of processes. Now, the implant guys that are out there, generally speaking, you should be using a type 4 die stone, a low expansion stone for that work. You may use a model stone as an opposing. And then, of course, mounting and especially stones that would come up, perhaps scannable type stones, things of that nature that you're involved with implants and implant bars. Those are generally the things you want to be looking at in those classifications so that you can narrow down your choice. Now, I didn't talk at all about color. Color really is not a terribly important thing at this point in time. Everybody has their own kind of a feeling about color. And I had one, I can tell you a little story, I had one laboratory call up. They wanted every stone we had in the color blue because they had brought in a designer for their laboratory, and they were trying to color coordinate everything that was going on in their lab. That's great, except that the color blue is not the determinant for what's going to happen physically with your stone, and therefore make your products either fit or not fit. It should be rather a secondary or third choice. There are some other colors of stone that may not work well with ceramics, simply because you've surrounded yourself with a color that is battling you as you choose shades or look at shades. And so you need to think about those kinds of issues with color. Now, let's talk about, just quickly, die stone and base stone. Most people use base stone. They find the cheapest thing they can find. That's not always the best choice. Also, you really should be using low expansion base stone, and most folks do not. And this may be part of the reason why you have trouble with especially long span bridges. If you look at the photograph here, say you use a die stone that's a 0.08, which is a low expansion stone. Let's say you leave it sit for even a couple of 3 hours. So you've got between 50 and 80% of the expansion in that time frame of the 0.08. And then you base it into a stone that, let's say it's a type 3 stone, which on average is somewhere around 0.16 expansion, almost double. And you wait for how long? Well, most labs I've been in wait until that base stone gets hard enough, and then they cut their dies apart. As soon as you do that, you've isolated the individual die from the rest of the master model that you have on the top, and your base stone continues to expand to its full extent. Or in other words, your dies start to move apart. Now, not too many labs think about that you really should be using a low expansion base stone regardless of the expansion of the die stone that you use. I've heard dyes say match the expansion of your dye stone to the expansion of your base stone or vice versa. It's not really accurate. Large expanding base stones are going to move your dyes no matter what you do. So please use a low expansion base stone. Now, Whitmix will have has a physical properties chart. This one's a little bit hard to see. I apologize for that. It's the best that I could get up on this particular slide. If you'd like to look at that chart a little more closely, I would refer you to the website at www.whitmix.com. You can choose gypsums at the top of the page, and then choose any gypsum that's on there, bring that page up, and then select technical support, and there will be a PDF there of the physical properties chart. That chart is divided up. If you can see on the left-hand side, you will have a listing of the Whitmix dye stones broken into those groups: dye stones, model stones, specialty stones, and plasters. And then we will give you the other physical properties that are reported. That would be your water powder ratio next, the amount of mechanical mixing time that you should use if you're going to do that, also a little bit of hand mixing time. You're going to have working time that's in there, the setting time for each stone, the expansion, which once again is reported at 2 hours, and you will have both wet, which is a 1-hour compressive, and dry, which is a 48-hour compressive number that's there, plus the color for those of you who are interior decorator types, and you will also have the ISO rating for that particular stone. Now, you should note that although Whitmix reports its dry finding at 48 hours, which is the minimum, dry compressive strength can be reported at any point after 48 hours. We've seen some manufacturers that report excessively high numbers. We've never been able to duplicate those numbers using the processes that we use here. So I would watch and not make decisions based on numbers that seem excessively high. Take a look at the other numbers that are involved, and you'll note that most of them fall into the same types or close categories as far as mix time and even working time. Working time is an important thing to some dental technicians. Most specialty stones, you'll note, have specific working times. For example, our lean rock is a very short working time. You're not going to get that time to extend. You're only going to be able to pour between 5 and 6 models. So if you're a laboratory technician that feels the need to pour 20 and 30 models at a time, that's not the stone for you. If you're looking at lean processes, this is the stone for you, because you need a stone which has been designed to work quickly, capture most of its expansion, which it does about 83% of the 0.08 in that first hour. So that one has been specifically designed. The remainder of them are designed to work in the time frames that you see on the physical properties chart. Now, impressions. There's a lot of comment about impressions and which dye stone goes with what impression, and there really isn't a big mystery here. There are some things that we need to note and that you should be aware of. So let's first talk about what Dr. Christensen reported in Clinician's Report in April of 2008. This is concerning alginate. Alginate impression should be poured immediately. That is within less than 30 minutes for the best accuracy and detail. What's happening to them after that or during that time frame, you all know. You've seen it happen if you've left an alginate impression laying around for a day or so. It becomes rock hard, shrinks all over the place, and is totally unusable. That shrinking begins the moment it gets pulled out of the mouth. And so the faster we get dye stone in there, or stone of some kind in there, the better off we'll be. Some of you are getting phone calls from your laboratories that say, I have a pickup. You zoom on over there and you find a big blob of wet towel wrapped around something. And by the time you get back to your laboratory, it's been way more than that 30-minute time frame, and you run some risk there. So Dr. Christensen said that storage in a sealed plastic bag actually maintained accuracy up to 18 hours. Now, when he was talking about a sealed plastic bag, he was not talking about the Ziploc bag. He was talking about a bag that was actually used, a food processing bag that was literally sealed. Then it'll work up to 18 hours. He also noted what you see as the last bullet point: wrapping impression in a moist paper towel was not as adequate as storing in a bag. That was a real nice way to say it's not the right thing to do. So you might have a discussion about that if you are the one. Best point would be to have your offices pour that impression with a correct material using a correct water powder ratio so that you get an accurate, or as accurate as possible, representation of that patient. Now, polyvinyl siloxane materials, or PVS, is probably the most used material now. There's another version of that, which is vinyl polysiloxane. It's basically the same thing. It's just a little molecular change. These are generally the two color materials that you see that are on the market coming in. What's important to them is that there must be a proper mix and working time used. You've all seen impressions. We'll talk a later date and another webinar about impressions and what you should and shouldn't reject, basically. What is a good impression, what's not, and what are some indicators for that. We'll do another webinar on that. But proper mix times, proper working times are very important in those impression materials. The doctor or the dental assistant needs to be using passive pressure for the entire set time. We've seen this before where more than passive pressure has been used. They've actually used lightweight, non-rigid impression trays, flex the tray, and then when they pull the impression from the mouth, the tray flexes back. Now we have a distorted impression. And you cannot fix that by the expansion of your die stone. So there's something to be taken a look at there. We need to avoid movement of the impression during the set time, and that includes what we commonly call the handoff, which is where the doctor hands it off to the dental assistant, or perhaps the dental assistant hands it off to the patient to hold that impression in place. That's a whole different amount of pressure that's being used there and can distort your impression. Latex gloves, we know, have been an issue in the past. Methyl methacrylate contamination, that's the contamination usually created by temporary materials. And the last one is, in general, we need to allow PVS impression materials to set for at least 2 hours prior to pouring. Now, there are some on the market that have what's called a hydrogen scavenger that eats up the hydrogen that's being released. And I've seen printed materials saying that you can either pour them immediately or within a short time frame. You need to know which impression materials those are. So I think the best way to do that is to find out exactly which impression materials your doctors are using. And then gather the information about that individual impression material so that you know. And perhaps you might even need to tell the doctor's office and his assistants to hang on and not pour them for the amount of time that's prescribed by that impression material. Now, in the ADA Professional Product Review, you can see the issue there. It quoted this: not all elastomeric impression materials are compatible with dental gypsum products. And we'll talk about what that compatibility is. Therefore, the ADA, ANSI, and the ISO standards require that the impression material manufacturer specify in their instructions at least 2 gypsum products that are compatible with their product. Generally, that's one type 3 stone, which is model stone, the yellow stone that we're talking about, and one type 4, or a dental stone, die stone, high strength, low expansion gypsum product. Okay, it's important that the gypsum product you use is compatible with your impression material. Now, when they talk about compatibility, they're talking about the fact that the gypsum will reproduce what the impression material produces. We're not talking about compatibility chemically. There aren't any compatibility issues chemically that are going on there. Okay? The only one that we do need to concern ourselves and worry about, of course, is if we go back to those that are water mixed, because you'll note also that your gypsum is being water mixed, and therefore the combination of water in your impression material and perhaps too much water in your gypsum stone may cause you surface problems on your gypsum. That's not a problem with the gypsum, problem with the amount of water that's present. There are other issues in surface, and we'll talk about those at another date. But generally speaking, I think I've even got a slide in here that will tell you that problems with your surface are not problems with chemistry in your gypsum. It's problems with chemistry on your gypsum. So you need to take a look at that. Now, you need to understand that impression materials contract. That contraction is different for each different impression material that's out there on the market. And each impression material will tell you in their fine print somewhere in the little package insert what that contraction is. Now, I've indicated that contraction. I've taken basically a quadrant impression here, filled it with some dye stone, and then just ran it on the model trimmer there to cut it off, just to give you an indicator. You can see where this contraction is going to take place from the inside of your pattern toward your tray. Now, if they've not used some kind of a tray adhesive there, you've all seen this. When the contraction takes place, the impression material pulls away from the tray. You cannot overcome that pulling with an expansion of a dye stone, or even by pushing it back. It's already damaged itself, and you should have the doctor redo that impression. I've heard it said before, in many instances, that you should match the expansion of your stone material with the contraction of your impression material. Now, let's think through that statement just a bit. We can look at the next slide here, or next two slides. Let me tell you first that 3M, which is a major player here, reports the contraction of their impression materials anywhere from 0.001%, which is very tiny, to 0.4%, just depending upon the material. And that's a good linear change when you're thinking about impression material. Now let's take a look at this side. If gypsum materials expand and impression materials contract, what's really happening? If you look at the yellow arrows here, you'll see where the impression material is going as it contracts. So the dye space is actually becoming larger as the impression material contracts. So why would you put a large expansion dye stone in that space, which will actually make that dye even larger? Now, if we know that, as I told you before, the reported expansion is at 2 hours, most of you have poured that dye stone, you've waited 1 hour, maybe, and then you've pulled that stone out of that impression, and that stone will continue to expand. It'll expand to the 2-hour point, which may be at 0.08, or it may be at 0.28 expansion. You've got a dye that's quite a bit larger than that original reproduction of the prep in the patient's mouth. So you should have a crown that, for lack of a better term, fits like socks on a rooster, as they say. What we should be using are low expansion stones, unless you have determined that you specifically need more room. And that would be based on perhaps doctor preference. Let's do an if-then. If the impression material contracts, then the size of the prep in the impression gets larger. If the gypsum material expands, then the size of the prep, which became larger with the contracting impression, becomes even larger. So if you're fighting that larger battle, you're going to have to look at using smaller expanding die stones. All right, so let's do some general rules here, and we're nearly at the end. First of all, find out the contraction of your impression materials. Now, they're going to change. Usually you're going to see changes in impression materials showing up right after, oh, say, the Hinman meeting, or right after the Chicago midwinter meeting, when they pick up all the samples. And you will note that most impression materials are sold either by ease of use, their speed, or whether they're hydrophobic or hydrophilic. That's about it. Nobody ever talks about contraction. So you're going to have to dig for that. Most of your doctors will not know what the contraction of their material is. You're going to have to find it in the package insert so that you know what's going on. Use a reported low expansion die stone. Remember that that reporting time period is 2 hours. It's not 48. Your die stone is going to continue to expand. Some of them I've seen on the market will report a 2-hour die stone expansion at 0.07 or 0.08. And then one that I know of reports a 48-hour expansion of that same stone, which was at 0.07 at 0.19, which is quite a bit different than where you started. So you need to understand what your individual die stone is doing. If the fits are tight, rather than just slopping on a whole lot more of die spacer, try using a larger expanding die stone for that doctor. Make the fit just a little bit looser as an end product, but your processing becomes the same. We know that globbing die spacer on there, if you talk to any waxer, usually drives them nuts, and metal finisher drives you even crazier. And it doesn't change what's going on at your margin because you're not covering the margin, so you're still going to be tight down there. So try just a little larger expanding die stone. Now, recognize that not all doctors perceive tight the same. If you have a group of doctors and 1 or 2 are reporting tight fits, but the others are just fine, the chances of a problem happening in your laboratory is pretty minimal. It's probably a problem that's happening in their office environment. So you're going to have to check that out, check the entire procedure out. And then you might recommend for that specific doctor or two using a different expansion in your die stone to alleviate some of that fit. Now, once again, surface problems with the stone are not chemistry in the stone. There's nothing in there creating gases. But there's plenty of chemistry that could be acting upon the stone. That goes for all kinds of disinfecting materials and other problems that have been transferred to the stone from the impression. So we've got to take a look at those things. All right, a little continued rules. Use low expansion base stone as a general stone, unless you find some other reason to use a larger expanding stone. Understand that when you switch stones for other working properties, for example, if you've decided that you need a stone that takes longer to set, if you just look at the setting time period and you're not focusing on expansion, you may change other factors in your end product. So make sure that when you switch, you want to begin with a stone that is close to the same expansion that you've been using so that your fit properties are the same in your doctor. Higher compressive numbers don't necessarily equal harder surface. You will notice that no one is reporting Rockwell or Burnell numbers on die stones. Okay? So if you need a harder stone, you might consider some kind of a gypsum hardener or a surface hardener, something like that. You might also consider that your technicians are just being entirely too hard on their die. That happens more times than you would care to believe. So a little less pressure, a little less hardness while they're doing speed work may help you out. You are not working with a material that is as hard as resin or epoxy or anything like that. You're working with gypsum, and it has limiting factors. First of all, and last of all, mixing stones together changes all of the properties, not just one of the properties. So if you're one of those that is concocting, please remember that you're changing all of the properties that are going on in that stone. You can't just change one and not affect the others. So that goes also for those of you who like to simply mix stone with water in the sink, who are not doing measurements properly. You cannot hold the stone manufacturer to the other physical properties if you're not following that water-powder ratio. That's where those things were tested, and that's what will make the difference to you, regardless of whether you're an old dental technician like this guy and have been doing it for 30 years. We've got to do it correctly, do it the right way, make sure that the chemistry works. All right, that's the end of our program for today. So I hope we've answered a few of the questions, or perhaps caused a few questions, some things for you to think about. Please don't hesitate to call us here at Whitmix if you have further questions. And there may even be some who have typed questions in at this point in time, so I'm going to turn it back over to our facilitator.
All right, so we do have a few questions, and I'm going to go ahead and start asking Craig. But if you have any questions, I did fail to mention in the beginning, you can write them in the questions box on the right, or located on the right-hand side of your screen. So Craig, our first question is, when specifically would we need to use a type 5 in fixed cases, and why would you need more expansion?
Well, I think the biggest place is the one spot that we mentioned before, where you've got a doctor who is consistently complaining of tight fits. You may very well find that it's just as easy to switch for that particular doctor and go to a type 5 stone where you've got a little more expansion. The other place is actually for those of you who are doing some kind of acrylic work. I've known some orthodontic laboratories or Crown Bridge labs, for that matter, that are doing hard night guards that prefer doing that night guard not as a master model, but as a working model on a type 5 stone, because we know that the acrylic is going to shrink as it's processed, and we get a little better fit if we have begun the process on a type 5 and then move to a smaller expansion die stone.
All right, our next question is, do you ever find any difference in physical properties between different colored die stones that are otherwise the same product?
No, generally not. Color is pretty basic. It's not part of the chemistry that's going on in the die stone. The die. Remember that gypsum is really a rock, and it's a crystal rock. And so as the gypsum goes back into its hard state, you provide that water so that the molecule is complete again, and then the crystal begins to grow. The colorant really just surrounds the crystal, and so you should not be seeing differences in different colors. I've never noted one in any of our testing here at Whitmix to show differences simply because of color.
All right. How do the physical properties of compressive and flexural strength relate to overall hardness? And is there a best hardness range to offer a nice balance between abrasion resistance and brittleness?
Well, there is a very odd relationship between compressive hardness and or compressive strength and what we would call hardness, but it's a mathematical equation that you wouldn't want to have to follow. So I think the best way to tell you this is that there's more of a relationship between how fast the stone sets and its compressive strength and the end-use compressive strength. You want it to get to as large of an expansion as possible. So those stones that actually take a longer period of time to go through a set time are going to have harder surfaces, if you will, because the crystal growth has had more time to move. Some of you are using slurry water as a means of making something happen faster. And you'll note that that won't necessarily change any expansion in your stone. But because you've limited the growth time of the crystal, you will see a little difference in the surface hardness that's there. So the best thing to do is to have a stone, if you're really worried about surface hardness, have a stone that takes a while to set and give it that time to set. So for a model, give it 2 or 3 hours, 4 hours, give it overnight before you start working on it. If not, if you don't have that kind of time frame, then you need to use some kind of an additive to that stone or a surface hardener. Now, be aware though that if you're using a resin-based stone, generally adding resin hardeners or other resins to that will goof your stone up too. So resin-based stone users, you need to be using just a surface type of a hardener.
All right, our next question is, the alginates I get are soaked in wet towels. Should I recommend then only using damp towels for storage?
Yes, absolutely. Alginates mixed at a certain ratio. You've seen that happen before. You can add too much water to alginate. That's why the alginate companies usually provide a little scoop. And then if you've seen the water ratio little canister that they have in there, it'll generally it's a little clear plastic thing with some lines on it. And then there'll be 1 scoop if you use a line, and a 2 scoop line, and a 3 scoop line. But that ratio has been worked out. You can add more water. You can superhydrate an alginate. And so if you've taken that alginate impression and then you're wrapping it with absolutely soaking wet towels, you're giving the alginate more water to absorb and therefore changing the shape. So absolutely, soaking wet towels are not necessary. A dampened towel that's been wrung out is okay, but as Dr. Christensen told you, best thing you could do is have them seal it in a plastic bag so that the atmosphere that it's in remains hydrated.
All right, our next question is, slurry water is used to facilitate setting times. Does it affect physical properties? Can you get the same effect by using some of the powdered stone instead of collected slurry water? Why or why not?
Very good question. It has to do with chemistry, basically, and what's going on. Slurry water is nothing more than set powdered crystals that have already gone through the rehydration process and are now being transported, for lack of a better term, in a whole bunch of water. For those of you listening who aren't familiar with slurry, that's the garbage that comes out of your model trimmer. And most old technicians have known for years that you can add slurry to stone and it'll set up faster. The reason is because you're adding the crystal, the set crystal, into a crystal that's trying to grow, and it acts as a catalyst. Now, the definition of a catalyst is that it causes a reaction but does not participate in the reaction. So it's not going to change your expansion, as we noted here in the course, but it will, because it's limiting the time frame that the crystals have to grow. It's forcing them to grow rapidly. Therefore, it is going to give you some surface softness compared to a dye stone that's been allowed to generate its crystals at its normal growth rate.
All right, we are at our 1 hour mark, but we still have a couple more questions, so we're going to keep going. So if you're able to stick with us, please do. If not, everyone who's going to leave, have a wonderful day, and hopefully you will attend our next webinar. Our next question is, what happens to expansion or other properties if you do not use the correct water-powder ratio? I believe you might have already answered this one, but I know it's a really important thing to go over again.
We hear this a lot, what happens, and the reality is that within 1 or 2 milliliters per 100 grams, on either side of that number, you're not going to get a real change in your expansion. You will get a change in your other properties, however. You're going to get a change in the compressive strength, either up or down. Okay, too much water, lower compressive strength. You shorten the amount of water, you're going to get higher compressive strength. On the other hand, if you shorten the water, you're also going to get a faster setting time and a faster working, or a shorter working time, excuse me. And the opposite is true by adding water. But within that little space, you're really not going to see a lot of difference. Now, I will tell you where you will get the difference, and that is back to those technicians who are trying to pour 10, 15, 20 impressions at a time. You mix up a big batch of material, and you're really studious, so you mix it correctly. You get to impression number 9 or 10, and you have a problem for one reason or another, and it stalls your speed. And as you get back to 11 and 12, you'll notice that your stone is starting to set up, so you go to the sink and you add a little more water. Now the remainder of your pores are going to have a different expansion because you've taken set crystals and setting crystals and you just spread them apart with more water. So that's where the problem lies. Had you added more water in the beginning, then it wouldn't have affected the expansion, but it would have affected the other working properties.
All right. Our next question, why does Whip Mix not make a gray or black base stone anymore?
The biggest reason is because we didn't have enough of you buying it. The black base stone and gray stone has been around before. We've used it. A lot of technicians initially liked it for working, but we just didn't sell a lot of it. And since we don't manufacture things in very small batches, most of the batches we make out there are 1,200 pounds of material or more, the stone just sat around and didn't sell. So that's really the biggest reason. If you would really like to have a black stone, it's entirely possible that you can take one of our regular stones, go down to a masonry or a concrete shop or a place that does swimming pools, and you'll find that there are color additives for gypsum products, and you can use that and make up your own.
All right, our next question is, how do gypsum hardeners work?
Well, most of them work by filling in space on the surface, or floating, if you would, floating to the surface, and then setting up, very similar to a matrix. Remember that this stone product is crystals growing, and if you look at a whole bunch of crystals, you'll notice that they kind of lace in and out of each other, and that there are spaces in between the crystals on the microscopic level, and so hardeners fill those spaces. That's what goes on with them, and they can be used anywhere. Now, the additives, if you do that, you may find that the additives were designed to be used in place of water, and generally speaking, you're going to want to use a lower liquid to powder ratio. For example, if we say use 20 milliliters of water per 100 grams for normal work, and you're going to use the hardener instead, you may want to use, instead of 20, you may want to use 18. You may find that 20 makes the stone too loose and too flowable. That may be an issue for you. So you may want to experiment a little bit there. But basically that's what it's doing. It's just filling in the space.
Okay. When would you use a mounting stone versus mounting plaster?
Well, mounting stones and mounting plasters have different expansions, so you may want to take a look at that first of all. Second of all, I would use a mounting stone if I were going to be transporting my models anywhere. For example, if you have compatible articulators, one that's in the doctor's office, one that's in your laboratory, and you're just going to transport stone back and forth, or transport models back and forth, I'd mount them with a mounting stone. It's a little tougher material and very low expansion. Mounting plaster, something you can use quickly, rapidly, right in your lab, and away you go. Also, generally, lower expansion stones generally, at least I can say this for Whip Mix stones, over the long term expand less than plasters do. So a reported stone at 0.09, for example, may move to 0.11, which isn't a lot of movement. A reported plaster at a 0.12 may move as far as 0.20. So if you're trying to retain accuracy on a very accurate articulator, I'd stick with a mounted stone.
All right, well, we're going to wrap things up with our last two questions here. The first one, will liquid epoxy make the stone harder, and can it affect the shrinkage of the stone?
Well, stones don't shrink, so I should tell you that right off the bat. They expand. So the liquid epoxies like Epoxit, which is a pretty prevalent one that's out there, isn't going to affect the expansion of the stone. It's just going to be a filler material and will help to harden the stone. Just a reminder, once again, you shouldn't use that with resin-based stones. That would be on the whip mix side. You don't want to use either the XL5 or our regular resin materials with those resin or epoxy additives.
All right, and our last question is another product-specific question. Why do we not make lean rock in white?
Generally speaking, just because we haven't had a big call for it. Lean rock's is a great material if you're following lean process and you're willing and you recognize that what you're trying to do is move something very rapidly. It's just the general colors are most popular colors out there are usually some kind of an ivory color or a blue color, and so that's where we began, and we just simply haven't had a call, large enough call for white.
All right, well, that is going to wrap up today's webinar. I thank you all for attending and staying on with us as we finish up our questions and answers. Like I said before, this webinar is NBC approved for 1 scientific credit, and you'll be receiving an email in about 24 to 48 hours with information on how to obtain that. We also have our webinars on whipmix.com/webinars that can be viewed at any time, which are also available for credit. If you have any questions, please feel free to email us at webinar@whipmix.com or give us a call. So we hope you have a wonderful day and found this webinar informative and everything. So have a great day.